Hey ladies, welcome back. Today I want to talk about vaginal bleeding after delivery. So what's normal, what's not normal? First of all, a little bit of vaginal bleeding after delivery is normal, especially the first week or two. It's going to be like a period. It might be a little bit lighter, it might be a little heavier. You may pass some clots. Clots can be normal as long as they're not huge. So what am I talking about when I say huge? Golf ball size or greater, that's considered huge. Dime size, quarter size, $half size, pretty normal. What am I talking about when I say heavy vaginal bleeding? So if you are saturating a pad an hour and having to change your pads every hour because you are fully saturating them, that is too heavy. That is not normal. It needs to be evaluated. So what does a fully saturated pad look like? Mind you, this is my son's paint. It is not blood. This is not a science project. So this is a pad that is considered fully saturated. It's one of those large maxi pads. It's fully soaked almost from end to end. That is abnormal. If you're having to change the pad because it looks like this on an hourly basis, you need to be evaluated. So you need to notify your physician or your midwife pretty immediately. Now, if you're changing a pad every like 3 or 4 hours because it looks like that, that's still on the normal side of things. If it's slowly improving over time, so every day it tends to get lighter and lighter, nothing to be worried about. That's still in the realm of normal. If you're having to change your pad and it's starting to become more frequent, so you started out every 3 to 4 hours, now it's every 2 hours, and it feels like it's going to be every 1 hour pretty soon that you're having to change pads because they're fully saturated, that's not normal. Probably need to be evaluated. So just let your doctor or your midwife know so that they can take a further look into things, make sure that there's nothing more serious going on. So what does a normal pad look like after delivery? This would be normal. So it's like a light period, maybe a little heavier than a light period, but it shouldn't be saturating a pad fully. You shouldn't have to change on an hourly basis. Now, if you're changing hourly because it makes you feel better, you feel cleaner doing that, that's fine. As long as they look like this and not much heavier than that, that's totally fine. If you're saturating, you need to let your physician know. So a question that I get asked frequently is, when will my bleeding go away? I wish I had a crystal ball. I wish I could tell you on January 5th, your bleeding after delivery will completely resolve. But I don't. Everyone's a little different. I have to say that some women will have bleeding for a couple days and completely go away. Some women will have bleeding for 2 or 3 weeks and it will completely just one day just go away. Some women will have bleeding and then they'll have spotting and they'll have bleeding some more and then spotting and then it'll finally go away. All that's considered normal. If you're having bleeding like a period or greater and you're like 3 or 4 weeks out from delivery and it's still every day, it's like a period or even greater, that's probably bordering on abnormal and maybe should be evaluated a little bit further. So just contact your physician, your midwife. They might want you to come in and take a look at what's going on to make sure that there's nothing more serious going on. A lot of women are super shocked when they have bleeding after a C-section, vaginal bleeding after a C-section. Very normal. You're still going to have vaginal bleeding after a C-section. So whether you have a vaginal delivery or a C-section, expect to have some vaginal bleeding after birth. That lining of the uterus that helps to supply the placenta has to go somewhere. It gets shed over time. It comes out of the vagina. It will go away over time. It just takes some time for it to completely shed and go away. So what should you use after a delivery to help keep your undergarments clean and dry? Please only use pads. I prefer the unscented large maxi pads for the first week or two to collect a majority of the blood. Unscented so that it doesn't irritate the skin and tissue. Don't use tampons. Avoid tampons. You don't want to shove anything in the vagina, especially if you had a vaginal delivery. You may have some tearing down there. You don't want to disrupt the stitches. You don't want to shove bacteria that's living in the vagina normally, that's normal, up against the cervix that can then infect the uterus. We want to avoid infecting the uterus. So nothing in the vagina for at least 6 weeks. So no tampons for at least 6 weeks. You want the vaginal tissue to heal, you want that cervix to completely close, and you want the uterus to do what's called involute, which means collapse down to its more normal size. So I hope this sheds some light on what to expect with vaginal bleeding after birth, whether you had a vaginal delivery or a C-section, and what to look out for, when to call the physician, when you can manage it at home. Certainly, if this raises any questions for you, or if you're concerned about your vaginal bleeding, please seek the help of your physician or midwife. And if you have any random questions, ask down below. I thank you so much for your time. I look forward to seeing you again real soon. Good luck, Mama. Bye-bye.